Hey guys, Dr. Derry here. We talked with Dr. Cardona in the past about direct primary care, its model, how she gets people in faster and gets them better quicker because of the access to removing the barriers. No more front office stuff, no more insurance stuff, no more just junk getting in the way between you and the provider. Now, let's say you have back pain. How does that model work when you have back pain? We talk about the biggest challenges in the healthcare system right now in treating back pain. What does she wishes people knew about back pain? How does she treat back pain when that comes in the clinic? And most of all, how her practice matches up with the evidence, how her line of treatment is most supported by the evidence, and how people are getting better faster and their expectations are being met. And they walk out of that clinic feeling better and happier and have a strong pathway with a provider that will walk alongside them the entire way. And that's what it's all about. And so check out this video interview with her. She was very gracious with her time, donated this time. So please check it out. And as always, please reach out if you have any questions, leave your comments, and I'm excited to hear what you think. All right. So thank you, Dr. Cardona, for joining me once again. In our last video, we talked about the direct primary care model and kind of your history and how you ended up where you are right now. So we're not going to spend a lot of time on that today, but I did want to touch on direct primary care and lower back pain. And so we know that direct primary care model is very different than the traditional model, and that the treatment of low back pain maybe should be a little bit different than the traditional model it is now, based on evidence and research. And so I wanted to pick your brain a little bit, and with being on the front lines of treating low back pain. And I wanted to start off with, what do you feel like is the biggest challenge when treating lower back pain?
I think my biggest challenge has been really, I think, access to specialty providers for my patients for treatment. That's the question. And once I get access to those providers, then it's buy-in. It's buy-in from the patient. Those are my two biggest challenges, I think.
Mm-hmm.
And from the buy-in standpoint, it's either buy-in that that's the right course.
Mm-hmm.
If they do buy in, then it's buy-in with cost.
Yeah.
That it's worth the cost, or that it's worth the time, or that they can give me the time.
Yep.
And so those really are the probably top challenges I have come across as far as treatment goes.
Okay, so give me an example. Like, someone comes into the clinic, they're with your model, they get in super quick, which is amazing. So they're, instead of going to ED, they say, Dr. Cardona, can you get me in tomorrow? You're like, yes, come on in. I've got excruciating back pain. Like, tell me how that plays out.
So if somebody comes in, I can get them in because access is great.
Yes.
And we go through an exam, history, physical, all of that, pretty standard stuff. And I determine it's not emergent.
Mm-hmm.
And I think that this is, musculoskeletal back pain that really just needs some conservative management. And let's say that it's somebody who needs, if it's something that I can manage on my own, meaning it's just me and the patient that we can manage, then great. We can talk about it. I can maybe go through some options with them as far as heat, maybe some, stretches they can do on their own. Maybe we can walk through some of them here in the office, and maybe we can talk about some medication options for their acute pain. And then we can talk about some activity restrictions in the meantime, and then we can schedule a follow-up. I mean, that's pretty standard that we could do for now. If it's something that I think that I need help with that goes outside of my comfort zone, or maybe I need a couple extra hands to help, or even a couple extra eyes to look at, then that's where I would need some assistance or referral to somebody else, maybe a physical therapist, maybe even an ortho. I don't know, sports medicine doctor, but generally not that higher level of care.
Sure. Yeah, I think what you're saying echoes a lot of what the research is out there and kind of the typical clinical pathway for someone with lower back pain. And just hearing you say that would make me think the patient would really value that time that you have to offer them on that visit to help answer those questions and just provide them with some assurance. And basically everything that you're giving them isn't a silver bullet. It's not gonna they're not gonna walk out feeling 1,000 times better, but they have some assurance and really that timeline that you're giving them of, hey, like typical soft tissue, musculoskeletal stuff, acute is this long. If you present like this, or you have nerve stuff, like you can kind of talk about those time frames a little bit. And providing that assurance can be huge. It can be huge. And I like that you didn't mention what the research is pretty clear about is that imaging is a first line use of lower back pain. Even though I'm sure you know this, like they come in, they're like, I think I need an MRI, right?
Right. And so if I were to answer your first question
Yep.
in a different way, another challenge to treatment that I find is also convincing patients that their back pain is not worse than it feels.
Absolutely.
And that's hard to do sometimes, especially when they come in immediately and they're in a lot of pain.
Mm-hmm.
And sometimes the level of pain doesn't reflect
Mm-hmm.
the source. And that's really hard to convince somebody that we don't really need to escalate the diagnostic workup.
Mm-hmm.
Meaning I don't need to send them for imaging, an x-ray or an MRI, which is usually what they ask for.
Yeah, absolutely. Yeah.
Because they're in a lot of pain.
Yeah.
And that's a really hard conversation to navigate sometimes.
Yeah. Yeah, I agree. I mean, I typically don't see people super acute, right? By the time they get to me, they are, they've been dealing with a little bit with some improvement, but kind of just some lingering stuff they're handling, where you're like these people in front of you would be almost willing to write any check or do anything to figure out what's going on and how to make it immediately better.
Mm-hmm.
And that's a big challenge when treating back pain and, other musculoskeletal stuff, but there is no magic bullet. And so the reason why that back pain happened or decreasing their risk factors for future low back pain are definitely conversations that we have. But I can appreciate the challenge that you may have when that person's sitting in front of you and wanting you to solve their issues, but your follow-up and the education on ice and heat and just the education in general of what their timeline is going to look like, I'm sure goes a long way with them.
It does, yeah. And fortunately, I have the time
There
to
we
do
go.
that
Yeah.
in my practice, which is nice. And I do think that the patients do appreciate that. And I have been able to talk patients, down off the ledge, so to speak, in a lot of ways. And having very, very close follow-up with patients is reassuring. And so I think that is very helpful in comparison to, my previous practice where I think it's really scary for patients to not have close follow-up with their providers and feel like if I leave this office right now without a plan and my pain gets worse, then what?
Yes. Yeah.
Then will it take me another 2 weeks to get back in?
Yeah.
Will it take me another 45 minutes to get somebody on the phone? Will I just be on my own? And I think that's a scary place, a scary headspace to be in.
Yeah. Oh, absolutely. And I think we've all been there with our own stuff that we've had in the past. We just want that assurance and that access. And that leads us to another topic. And like you went from this healthcare system approach to now with this more individualized, more intimate relationship-based model, where they have that assurance and they know like, hey, if things aren't going to the way that things should because of what you've told them, they call you and the access to you is so much better. And just having that phone call and giving them that reassurance could be the difference between them going, just staying the course or going to the ED and then demanding higher cost interventions and more risky interventions. And so, and it's clear the evidence does not support that for people who have had acute low back pain without neurological compromise that came from your physical exam. And so I think that's huge. It's huge. And your model, is ideal for those, for the low treatment of low back pain and other musculoskeletal disorders. And so I'm glad now you're in a different model that you can support the evidence a little bit more and there's less barriers for the patient.
Agreed. And I love to take books out and show them pictures and draw
Yeah.
diagrams. It's very helpful. Very helpful.
Yeah. Yeah, absolutely. Yeah. The downstream impact of you having that education is unmeasurable, right? And so it's not only applies then, but later, and then can completely change the course of their care. So what is one thing that you wish people knew about back pain? Like what's the you keep saying it over and over to people can't come into the clinic. They're like, my back is hurting. What is one thing that you wish people knew?
Ooh, one thing, just
Yeah.
one.
Narrow it down.
It takes time.
Sure.
It takes time. It takes time to see some relief in your symptoms. I mean, you may have gotten pain in 5 minutes, but it's not going to take 5 minutes to get rid of the pain. It's just going to take time.
Sure. Yeah. Yeah, that can be a heavy conversation at times because they're thinking about work tomorrow. They're thinking about keeping up with their kiddos. Those are all conversations and things that are going through people's head. And of course, like, what if it's something worse, right? That's always a big one. Like, how do I tell if my back pain is just from my back, right?
Right.
And so, man, those are tough conversations, but definitely ones worth having because what they find online or from other sources may be very negative, right?
Yes.
And lead them down a path that they really shouldn't go down. And I'm sure you get that a lot. They come in and they've already done their own research and self-diagnosed, right?
Yes. And oftentimes they won't ask me those things. I know they're thinking it, so I'll go ahead and answer it for them. It's just easier to do it that way. It's almost like I have my own frequently asked questions version with them. And I say, I know you're thinking it. Let's go ahead and talk about it because I don't want you going home and wondering, did I not address these things? And this is why. So if it was one thing, I would say it takes time. The second would be not all back pain is fatal. In fact, very few cases of back pain are fatal.
Yeah. Yeah. Well, and the thing is, what 90% of people have back pain in their life, 40% of people are walking around with aches and pains every day. And 10 times out of 10 times they've had back pain before and it's gotten better. Yeah. Right. And so they know that unfortunately it's just a process sometimes, right? If they don't have that, if maybe they don't have the active lifestyle that they should have or don't have the strength that they should have, they can be more susceptible to that acute onset. But everybody, no matter the shape, has experienced back pain in their life. And so it's something that our healthcare system isn't super good at treating, and the pathway is not really efficient. But people doing what you're doing definitely goes against the current of the current system. So it's awesome. It's really, really cool. It's so cool seeing people doing that type of thing. From a physical therapy standpoint, we've only had direct access for a few years, right? And so we're not really good at positioning ourselves as frontline providers for musculoskeletal conditions. We're getting better, but we're not there yet, right? So it's nice to see that there's primary care physicians that recognize what the evidence says, answers all of those questions. And while you may have to repeat yourself patient to patient, it is worth it. It does make a difference.
It does. It really does. And I mean, I just see it across every diagnosis that I have now. It's not just back pain, but I can name 1,000 diagnoses where, just taking 10 extra minutes to have an education discussion about it.
Yeah. To see, and I'm sure you've seen this, like to do a good myotome dermatome exam and say, hey, like your nervous system is healthy. Like you can get rid of all those thoughts that you've had about herniations or sciatica, stuff like that. Like you have mechanical, non-specific back pain. very normal. This is how things are going to go. And just spending that extra couple minutes to do that, even though you probably already know it's going to be fine, right? But in the patient's eyes, you do it, and it just opens up their world and how much you care, right?
Right.
Yeah, that's really, really cool. Really, really cool. So you went from the big healthcare system to where you are now. You're treating back pain more effectively and other conditions, of course, right? It's not just back pain that walks through your door. And so what do you feel the role of not only primary care but like orthos and what you're doing? I know you said sometimes you refer to orthos now, but do you feel like your relationship with them has changed because you don't necessarily have an orthopedic on staff?
It has.
Mhm.
It has changed. I really have not referred to ortho
Okay.
a lot,
Yeah.
truthfully.
Yeah, sure.
Um,
Well, and I think that matches the patient's preference too, right? They definitely are not coming to you wanting surgery,
right,
right? And so
right.
I mean, they know you already and they are a member of you, and they come in, they know what you have to offer, and they're with you because of what you have to offer. And so they're not coming to you wanting surgery. And that's nice. Because you've been in the prior situations before, like, hey, I'm going to set you up with Dr. Jones down the hall. He's an ortho surgeon, for somebody who may only have non-specific back pain, or even if they have some radicular stuff, like that's good prognosis as well. And so
Mhm.
I feel like you're decreasing the cost and the liability on the healthcare system.
Right. And I mean, it might be a little unfair because I think maybe my study size selects out for it because, there's definitely a type of patient that sort of chooses direct primary care, I think.
Mm-hmm.
Um, and a lot of my patients who tend to have ortho concerns, or happen to have ortho concerns, um, ask ask more questions about what are my options.
Yes.
What
Yeah.
are all the options that I have?
Mm-hmm.
Whether it's fiscally driven, whether it's I can't afford to go to a specialist, what can I
Mm-hmm.
do? What are all
Mm-hmm.
the things I can exhaust before I get there? Do I absolutely need an MRI? Do I
Yeah.
absolutely need to see an orthopedic? No, the answer is no to both of those
Oh,
things.
yeah, that's right.
Um, or it's not fiscally driven, it's just practically driven. Do I
Mm-hmm.
really need to take, half a day out of my schedule to go sit in an ortho's office
Yeah.
to really not get much out of
Yeah.
that visit because
Yeah.
it really isn't indicated. So, I've been very lucky to have that patient population who's been very open-minded about having discussions of thinking outside of the box and not
Mm-hmm.
assuming that an ortho complaint equals an ortho appointment.
Yeah. 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 That's exactly right. And I think, people that come in, like their behaviors are influenced by their beliefs and the people around them that influence those as well. And everybody has had those experiences where surgery maybe didn't help them, or they have these fears that maybe there is a better way, and you get to echo that when they come in. So that's really, really
Mhm.
nice.
Mhm.
And I think too, I mean, do you feel like it makes a difference that, your membership model is very clear in its pricing? Like you can find that online. You're like, hey, like this is what I have to offer. This is my price. Your outcome, is not influenced by other financial gains, right? There aren't metrics you have to reach. There aren't cross referrals that you need to do or should be doing. And I think people really, really appreciate that when they come see you, because whatever you offer them, it is an unbiased, evidence-based decision, right? And you're doing what's best for that person right in front of you. That's going to match their life, their experience, and what you believe is going to make them better.
Right, right. I mean,
And
that's really just, it's very transparent. I
mhm,
have no skin in anyone's game. This is
mhm.
This is my pure opinion on whatever's in front of me right now.
Yeah.
And this is it. I mean, you're paying me for a medical advice, and this is what
Yeah.
I'm
Yeah. Yeah. And the whole experience too, right? The experience is completely different, completely different. And yeah, I can appreciate that. So,
yeah.
all right. So we're solving the world's back paving problems in Jacksonville, Florida, right? They come
Oh,
to
yeah.
you, they come to you. They're like, hey, I've got some back pain. You calm down all their fears. You get them going down this pathway that is informed with evidence, but also matches what you believe is good for them and what they really want for themselves to help them recover and get better. And then you encourage active lifestyles to help prevent back discomfort as well, and help them get better and stay better. That's the whole thing. I can appreciate that. I've seen patients of yours that have translated that message to me, and they're a different breed, as you mentioned, and that these people want to get better. They're motivated, and they go in with that positive attitude. But you can just help decrease some of those fears along the way, and tell them maybe Google doesn't have all of your answers.
Right. They're learning that.
Yeah. Yeah. And it's always fun, when they come in and they've already diagnosed, but then you say some of the same things that they research, right? And they're like, oh, yeah, I heard that. And you're like, well, where'd you hear that? And they're like, oh, I researched it. So it's always like this little test, right?
Right.
And as soon as you pass, you're in. You're like, it's 100, it's good to go.
Right. Right.
Those are always really, really fun. Good. What is it? One last question, and then we're good to go. But so when you have that patient with back pain, and let's say they need a little more TLC, like what are your thoughts on like where do you see physical therapy falling in that, or massage therapy, or acupuncture, or chiropractic work? Like, what's your decision tree for there?
I mean, it's fairly simple. I mean, PT's usually at the top of
Sure.
that list for me.
Sure.
Everyone loves a massage.
Yeah, sure. Yeah. I mean, those are all just fairly conservative measures for back pain,
Yeah.
and people want the conservative measure, and if someone's not willing or really not wanting to take Flexerol or meloxicam, right? So you have these other options for them to help have some sort of relief that is less risk, right? There's really no risk with that stuff. And so I just didn't know if you base it off of patients' beliefs, if they're like, hey, do you feel like chiropractor is okay? Do you feel like massage is okay?
Oh, you mean as a lump?
Yeah, like just as a
Treatment option?
conservative treatment option.
Yeah. Oh, yeah. I'm totally for it. 100%. I encourage it. In fact, definitely encourage it. As far as acute treatment goes, and even for prevention of future, like you had just mentioned, for prevention, I mean, the best treatment for back pain is not to get it.
Yeah. Yep.
I mean,
Yeah.
just don't get back pain.
Yeah. Sure. It's that easy, right?
Yeah. So if we can prevent you from getting back pain, whether it's strengthening your core or doing some functional training or weight management, whatever it is, let's get that on board now. But to your point, in the acute management of back pain, I absolutely encourage you to establish a relationship with somebody you're comfortable with.
Yeah.
And that, I think, is a lot of that's belief system. A lot of patients have lean more towards, more Eastern medicine and prefer acupuncture. And that's great. I've seen wonderful results from that. And some people are a little bit more traditional in the sense of PT, and that's great too.
Yeah. And I think all of those disciplines, including yourself, kind of recognize, where we were 50 years ago treating back pain. We said, hey, stay in bed, take it easy.
Oh, yeah.
And where we are now, it's like I know when you're feeling down, it feels really bad, but you got to get up, you got to move, you got to walk. And so that alone has helped tremendously. And so it's just nice to see other professions kind of advocating for the same thing.
Mhm.
because sometimes it can be like, oh no, like don't do that because you need to rest.
Right.
It's like, well, like your body atrophies, like there's things, other consequences to that as well.
Mhm.
And that's not the intent. So, no,
Right. Right.
very cool.
Yeah.
Well, awesome. Okay. So we have talked about what people should know about back pain, kind of how your model is very different. And if we wanted to narrow down just on back pain, how you treat that very differently than maybe you would have in the past. And the fact that most evidence says, hey, conservative care, non risky intervention should be your first step every single time, unless you have XYZ. And those XYZ things are what you look at in the physical exam. And so it's just all coming together, it's all meshing. We're kind of seeing the way that back pain should be treated. And hopefully this catches like wildfire and people understand like it is something you got to get through. It does stink at that time. Like there's no better way to put it. It's just rough. You're in the trenches, you're dealing with it, but there is a light at the end of the tunnel. And then if you're having a harder time than suspected, then there's plenty of people to be able to help you get you to where you want to go. Again, that support that non-risky conservative care. And so just really, really cool to see that. I love seeing your patients. They're awesome. They're just really good people. They're getting better. And they come in with that mindset of like, how do I take control of my own health and work with a provider that's going to not bully me into a decision, but also make sure I'm going down an evidence-based track. And so I really appreciate what you're doing. You guys are always doing good things. Carol's super nice. You're super nice. Your clinic is awesome. If
Thanks.
anybody's interested in direct primary care, Dr. Cardona is definitely the gal to see, and just kind of brings that personality that really needs to come along with healthcare. So I
Oh,
appreciate you with what you're doing.
thank you. Thank you so much. I appreciate everything you do for my patients. They love it.
Yeah,
They
no
do.
problem. No problem. All right. Well, I appreciate your time. And once again, thanks for joining me.
Thanks.